So let's talk about the fight against cancer, but maybe not in the way you're used to. Think of it less like a single battle and more like a complex, strategic military campaign. Over the years, humanity has developed this incredible arsenal of strategies. And today, we're going to break down that evolving battle plan.
Okay, so let's start with the big question, right? At its very core, cancer is a disease where cells just grow completely out of control. So how in the world do you fight something that's defined by its refusal to stop? Well, over the decades, we've come up with a whole range of strategies, and they really fall into three major groups.
All right, first up, we have what you could call the foundational pillars of cancer treatment. You can think of these as the heavy artillery, the direct frontal assault on the disease that's been the standard of care for a very long time. The most direct approach? Surgery. I mean, it's exactly what it sounds like. A surgeon physically goes in and cuts the tumor out. For solid tumors, this is often the very first thing they do, and sometimes it's all that's needed. It's a physical removal of the enemy's stronghold.
Then you've got radiation therapy. This is kind of like a focused energy weapon. High-energy beams are aimed with incredible precision right at the tumor to destroy the cancer cells or just damage their DNA so they can't divide anymore. It's a targeted, localized attack. And then, of course, there's chemotherapy. This is a systemic attack. Chemo uses powerful drugs that travel through your entire body to kill any cell that's dividing rapidly. Now, its greatest strength is also its biggest weakness. Because it's such a blunt instrument, it can't always tell the difference between a cancer cell and other healthy, fast-growing cells, like the ones that make your hair or line your stomach. So all that collateral damage from the frontal assault, well, it really pushed scientists to find a better way. This next phase of treatment is way more sophisticated. It's like we moved from heavy artillery to precision strikes and special ops. And these smarter attacks, they are a total game changer. You've got immunotherapy, which doesn't even attack the cancer directly. Instead, it's like a drill sergeant for your own immune system, basically training your body's defenses to find and destroy cancer cells. Then there's targeted therapy. Think of these like smart bombs, designed to hit very specific molecular targets found only on cancer cells. And finally, hormone therapy, which cuts off the fuel supply for cancers that need hormones to grow, like many breast and prostate cancers. This right here really captures the difference in strategy. Where chemotherapy is kind of like carpet bombing an entire area, targeted therapy is like a sniper. The goal is to get maximum damage on the tumor with minimal harm to all the healthy tissue around it. It's a massive shift towards precision.
But what if, instead of just developing better and better weapons to attack the cancer cells, what if we could change the entire battlefield to make it hostile to the enemy? This brings us to a really revolutionary new front in the war on cancer: metabolism. And this idea, wow, this is a complete paradigm shift. It gets to the heart of a whole new way of thinking. It basically suggests that maybe cancer isn't just a disease of mutated genes, but that it's fundamentally a disease of broken energy metabolism, a problem rooted in the mitochondria, the little powerhouses inside our cells. So that new way of thinking, it leads to this strategy called metabolic therapy. The whole idea is to exploit a huge fundamental weakness in how most cancer cells make their energy. So the goal isn't to poison the cancer cell directly, but to change its environment and basically cut off its favorite fuel source. Okay, so how does this actually work? I mean, how do you starve a cancer cell while keeping all your healthy cells fed and happy? Let's break down this metabolic strategy. Okay, here's the absolute crucial point. Most cancer cells are metabolically inflexible. They are addicted to glucose, to sugar, and they use a really inefficient process to burn it for energy. Your healthy cells, on the other hand, are incredibly flexible. If you take away glucose, they can just flip a switch and start burning a different fuel called ketones, which your body makes from fat. The key is most cancer cells can't make that switch. And that vulnerability, it opens the door for a brilliant three-step strategy, sometimes called a metabolic press. First, you restrict glucose, taking away the cancer's main food source. Second, when you do that, your body naturally elevates ketones, which provides clean-burning fuel for all your healthy cells. And the result is step 3, you create an internal environment that puts immense metabolic stress on the cancer cells while actually boosting the health and resilience of your normal cells. And look, this isn't just some vague concept. It's a measurable therapeutic state. Researchers have actually identified what they call the zone of metabolic management. By getting blood glucose down and blood ketones up into these very specific target ranges,
The goal is to create an internal environment that's literally toxic to cancer cells. It's a data-driven approach designed to trigger what's called apoptosis, or programmed cell death, specifically in tumor cells, all while nourishing healthy ones. So, where is all this heading? Well, the future isn't about choosing one strategy over the other. It's about intelligently combining these forces for a truly personalized approach to fighting this disease. This evolving battle plan is definitely multifaceted. We're seeing powerful combination therapies, where different treatments work together to become way more effective than they'd be alone. Everything is moving towards personalized medicine, tailoring the entire plan to the individual person and their specific tumor. And we're seeing the rise of these incredible non-toxic approaches, like metabolic therapy, which holds the promise of managing the disease by strengthening the patient while simultaneously weakening the cancer. This whole shift toward looking at metabolism, it's bigger than just a new way to treat cancer. It's really a new way of thinking about disease itself. Which leaves us with a final, pretty big question. If we can learn to control the environment in which a disease thrives, what does that mean for the future of medicine as a whole?